Yes, thanks so much, Benjamin. So I'm just outside the main hall in the assembly, so it's a little bit loud. So just give me a thumb, you can hear me okay. All right, so I'll go very quickly. And as Benjamin mentioned, I have the privilege to co-chair a working group with him. It's a WHO-PREZODE initiative where we formed a working group to quantify indicators for risk of zoonotic disease emergence. And we work with a large number of people across the groups, but we're very happy to do so. Just want to set the context. So this is a map, it's a draft map that is looking at the spillover risk of a number of different pathogens across the world, looking at the aggregate risk of pathogens, their intermediate hosts, the reservoirs, but also looking at climatic factors, looking at the changes because of climate change, which is changing the opportunities for these viruses to spill over from animals, but also changes the range of vectors. For example, if we think of Aedes. And so this mapping exercise is to support countries in being better prepared for this spillover events, but also should these spillover events become outbreaks, epidemics, and pandemics. Next slide, please. So we have identified a need to quantify this risk of emergence in a multi-dimensional context, because it is a multi-dimensional and multifactorial nature. And the absence of widely accepted indicators hampers the impact assessment of prevention strategies. So what we have done is we've formed a working group of 20 experts and varied expertise from around the world to establish a framework capturing this complexity to develop indicators that are simple, easy to measure, and aim to quantify the risk of zoonotic disease emergence. And overall, our goal is operationalizing the One Health approach through evidence-based development of sustainable prevention strategies, which is ideally aimed at reducing spillover potential and ultimately preventing pandemics as much as we possibly can. Next slide, please. So the group is absolutely fantastic. They're from all over the world. We have good gender breakdown, and we have a variety of different technical expertise, but also different expertise looking at specific diseases as well. And those are listed on the right hand of the slide. Next slide.
I think Maria has lost her connection.
Oh, there we go. Sorry. Yeah. So what we are aiming to do is look at building a framework, looking at the different stages of emergence, if you will, looking at pre-emergence right now, and looking at the spillover potential, taking into consideration pathogens that are part of the WHO R&D blueprint priority list, but also and these are pathogens that have been identified because they don't have medical countermeasures, but also the number of other pathogens that WHO works on that are primarily focused on programs, husbandry, animal trade, surveillance networks, etc., and trying to have baseline and targets for risk reduction by geographic location and pathogen family. And our aim is to guide prevention strategies and measure the impacts of these interventions. Next slide, please. So we have a proposed methodology that we're working for. First step, reviewing all the existing data and tools that are available. Second step is developing the score. And third, testing, validating, improving the score. Next slide, please. And ultimately, at the end of the year, we hope to have 2 deliverables. The first is a draft of the methodology, identification of knowledge data gaps, and outline critical research avenues data that are needed to improve sustainability, substantially the first set of indicators. And deliverable 2, to draft a set of preliminary indicators that can be measured quickly and used by national and international health authorities when the implementation of these prevention strategies are discussed. So I'll leave it with that. And Benjamin, it's a privilege to work with you. It's a privilege to be part of PREZODE. And we look forward to continued constructive collaborations.